It is Tuesday, July 7th. Joe Delaronio, just welcome to a very hot Tuesday afternoon. And it's time for our COVID-19 Task Force daily update. Today on the program, I don't think it'll be too long, but there is plenty to talk about. We'll start things off with Lisa Westaway, the Executive Director of the Kahnawake Memorial Hospital Center.
Thank you. Good afternoon. I just have a very few quick updates to provide today. We had the drop-off for inpatient happen on Sunday. So just a quick note to say that that went very smoothly. We had a constant flow of people dropping things off for their loved ones. And as mentioned, we'll continue that every 2 weeks. And therefore, the next drop-off will be 2 Sundays from now, again from 10 to 1. But we'll speak about it again as we get closer. So thank you for participating in that. It's really nice. It's nice for our residents as well to receive gifts and things that you drop off for them. Secondly, I wanted to talk a little bit about the visits that are happening with inpatient at KMHC. So after the first set of visits, which went well but were difficult, we had a lot of recommendations from families on how to make these visits better, and about the need really to have physical contact with loved ones and to create a physical connection. And so we did make some changes, and we started those visits yesterday where if people are comfortable, we've spoken with the residents themselves and family members, the meetings take place at a closer distance across a table and with hand holding. So of course we have very strict safety measures implemented prior to those visits to minimize risk, ensure safety. But some preliminary feedback that we've received over the last couple of days is that those visits have gone really well, and that residents are happy that they're able to communicate better, that they recognize their loved ones, and that they're actually taking the full 30 minutes for the visit. So in those first original visits that were at a very big distance, residents were asking to go back to their room after 5-10 minutes. It was a bit more cold and impersonal, and so I think that this has been a nice step, and we're going to continue to evaluate throughout the week to see how we can improve things. Already today we're making changes to the room to make it a little bit more personal as well, with some plants and some artwork, and so again we're going to continue to make these improvements as we move forward, keeping in mind that the virus still does exist and we have to still be mindful and careful at all times, but this is a happy medium that seems to be beneficial to residents and their well-being, so we're happy to continue to move forward with this. So that's it for the updates today. Thank you for listening, and I'm going to pass it back to Joe. Thanks.
And thank you very much, Lisa. And just a note for visitors, or who are planning to visit, that is, actually you can schedule in advance. I think that's probably the best way to do it. Call the Kahnawake Hospital 450-638-3930, and you can do so that way. And then you call them. There you go. All right, coming up next with the information, not all of it good, because if you've been watching TV in the States, you know that it's pretty rough down there. We've had some news up this part of the world as well. Arnold Lazare from the COVID-19 Task Force will give us this update.
Good afternoon, Kahnawake. This is, as Joe mentioned, we know that we're following what's going on around us, and unfortunately it's not all good news. I think everybody would have heard now that in one of the neighboring communities there was a house party with 50 people, and a result of that house party is those 20 to 30 people are now testing positive. And not only did it affect the house party, but it also affected several businesses. This is just a reminder that this pandemic is not going away, and we need to continue to be very vigilant. The physical distancing needs to be respected. There was quite a few events this past weekend, and based on a lot of feedback, there was a lot of good feedback, but there's still the concern that people are not taking this infection as serious as they should. Just a clarification that for public events, there's 50 people. But if people want to have items in their personal residence, it's limited to 10 people, inside and out. So that's to say that there wouldn't be 10 people inside and 10 people out. It would be only 10 people maximum. There is a task force meeting tomorrow, and based on what's going on around us, the task force will look at the upcoming dates. But once again, we need to continue to be very cautious. We will make decisions that are based on the health and safety of the community. And we need the continued support of all Kahnawake people. Having said that, we hope you had a good weekend, and please stay tuned. We will be back on Thursday. As mentioned before, we're going to be cutting back the amount of Kahnawake 911 telecasts unless there's an urgent issue. But the next scheduled one is Thursday, and we would look forward to you providing some information at that point. Take care, Kahnawake.
Thank you very much, Arnold, and there will be some news as we get to Thursday with that meeting coming up tomorrow. Just some notes that are happening here in Kahnawake. The splash pad over at Orville Stand-Up Park is back in operation. Apparently everything is going well today. I haven't passed there yet, but I can imagine with this kind of weather, lots of kids out there. Remember, social distancing, etc. It's really hot, so take care. Make sure you have water and put on some sunblock, all of that usual stuff. Also, the lacrosse rink at Orville Stand-Up Park is going to be open. Now, it may be open now. No scrimmages, no contact, only practice individual drills, and also you can maybe like shoot on the goaltender, things like that. But remember, it's not open until the signage is in place. So please be aware of that. And finally, as mentioned earlier, some of the outdoor sports are back up and operating, and minor baseball is in full swing. They're not having games yet, but the teams are starting to practice. Again, if you're practicing tonight, make sure you have some sunblock, bring some water with you, and find some shade if you can when you're not out in the field. That'll do it for us. We'd like to thank you for taking a few minutes of your time, your busy time, to join us on this task force update. We'll be back, as Arnold said, on Thursday. So on behalf of everyone here, Nyawokoa, and we'll see you next time. Onigiwai.